Good afternoon. I think we're ready to go. Today is March the 19th, 2020, and I'm Deborah Murray, the Executive Director of the Caldwell EDC, and today we meet virtually for the very first time with our HR Roundtable. The HR Roundtable turned into a business leaders information opportunity, and we want to take a moment to talk about what COVID-19 means in our community and how well prepared we are. It's an understatement to say that the world has changed in the last few days, and I think it's going to change every few hours from here on out for a while. We want you to understand what our local people have done to be prepared for it. Yesterday, Caldwell County declared a state of emergency, as well as our municipalities, and that's made it possible for the public and the businesses and our local government to respond to this national crisis. They were responding before, but this allows a different type of organization for those kinds of things, and I'm sure that Dino DiBardina will talk about that in a few minutes. To date, there have been no confirmed cases of the coronavirus in Caldwell County, and we want to make sure that everyone stays up to date as much as possible. We're going to give you ways to do that today as well. I have with me today Anna Martin, who is our Public Health Director, and Dino DiBernardi, Chief of Emergency Services for Caldwell County, and Laura Easton, who is the CEO of Caldwell UNC Health. And we're going to hear from them, talk about what their organizations are doing and how they've prepared, and perhaps give you some good information for your organization as well. So Anna, please come join us. Thank you very much for taking the time out of your day for this.
Thank you. Like she said, I'm Anna Martin. I'm the Health Director for Caldwell County Health Department. I'll just give you a little background of what's been going on. To date, there's currently 97 cases in North Carolina currently, and we have 0 cases in Caldwell County as of right now. So we have a lot of behind-the-scenes footage going on. We've been preparing for about over a month now. But I do want to thank our partners with EM and UNC. We've been working on this and trying to figure out what's the best for our community. We've been pushing different types of messages, whether it's wash your hands for at least 20 seconds or, staying home if you're sick, or, just covering your mouth if you sneeze or cough. And those are the big messages. But right now, our message that we're pushing as much as we can is that if you feel sick and you need to go to the doctor, to call ahead of time so people can take precautionary measures before you get there. At the health department, we've set up a triage line. I guess it's more of a health information line to call. That number is 828-426-8456. And on that information line, you're directed to another phone, which is our health educators that will give you more information about COVID-19. But then there's another number to call if someone is showing signs and symptoms, whether it be, you have a fever and you have respiratory illness. However, it is directed that if they're in respiratory distress, to call 911. With that, it's going to a triage of nurses, and then they will be able to test depending with our provider's assurance. So we have that going on, and as well as walk-ins. Walk-ins will be directed to call another number to screen, but we are encouraging people to call ahead. And by calling ahead, we can screen those and tell them what we need to do. So that's kind of what we're doing in Caldwell County from the health department side, just calling ahead and calling that information line. That number is 426-8456, and like I mentioned, we have 0 confirmed cases. I do want to mention there's some confusion with quarantine and isolation, and I just want to get that information out. So if someone is isolated, so anybody that is tested is put into isolation, if you will, for 14 days. And with that being said, if the test comes back negative, it has to be 7 days past the symptom onset or 72 hours fever-free without medication. And then if they're put in quarantine, that means they're exposed to someone that has a confirmed case, and that is another 14-day quarantine. However, with the isolation, it's not exactly a 14-day, and if they're showing symptoms, it just depends on their onset of symptoms and whenever they go away. That's been a lot of confusion of isolation and quarantine. So isolation is they are showing symptoms, and quarantine is they've been exposed to someone. So I know there's been questions with businesses and employers, and right now state guidance is basically just leaving that up to businesses to come up with their own plan to figure out what best fits within their own area. With us, we're allowed to say, if you've been isolated or quarantined, we can do those orders, but talking with different businesses and figuring out what they like to do in their area. And sometimes that means that they just need to stay home, because we're highly encouraging people that if they're sick to stay home. So if they've been around somebody who has been exposed, that they need to stay home. But if they're being tested, that might be what's best for them as well in the business area. So.
I think we'll turn it over to Dina.
Good morning, or afternoon now. Dino DiBernardi with Caldwell County Emergency Services. Our component of this, of course, is the emergency management side. Generally speaking, we're supporting our partners in local government, municipal governments, as well as emergency response and the healthcare facilities, which would include Caldwell UNC Healthcare. As of right now, we've been working on this for well over a month. EOC is activated. We have a skeleton crew, as we call it, limited activation with our general staff at this time. With the state of emergency, it's a little different than what we are used to. Of course, this is not related to a disaster. It's a healthcare crisis. So a couple changes that we are recommending to local businesses, whether that be national, true local, or regional. FEMA does not require a local declaration to receive reimbursements or be eligible for reimbursements on this type of disaster, if that makes sense, because we're looking at a healthcare crisis rather than a natural disaster. However, we are asking businesses to track your costs directly related to your response or recovery from the COVID-19 outbreak. We will help with that, of course, through emergency management. We'll be pushing out any kind of guidance that we are getting. It's very early on in the process, but as we get that, we'll be sending that through the EDC and our local partners. The main reason for us to declare the state of emergency is to implement our emergency operations plan, to assist with the restrictions set forth by the state and federal government, and then honestly the biggest key point here is to increase flow of verified and accurate information. As we move forward, you as business owners and HR personnel can absolutely contact the emergency management and EOC if you would like. Our numbers are very well published. 757-1424 is the direct number. 757-1419 would be our emergency management coordinator, and 757-1328 is my direct line to my office. I know that there'll be a lot of questions for each of the presenters today, but as we get to those, please feel free to ask directly for if you have something specific for emergency management as well.
Hi, I'm Laura Easton. I'm the president and CEO at Caldwell UNC Healthcare. And thank you, Deborah, for the invitation to come and talk to you all today and share with you what the UNC Healthcare system is doing. And first, let me start out by saying we really want to be here for you during this time, which is very frightening to many people, and there is a lot of unknown. We're working really hard to put together a process and system that'll help take care of you and your employees and the community at large. And let me share a little bit about that today. What we would like to do is have anybody who has respiratory symptoms and would like to be seen to please call their primary care provider. We have clinics all over the county. Most of you know who they are, and up into Blowing Rock. Each of those clinics is prepared to take your call and help determine the best location to direct you to, depending upon how you respond to some screening questions. If there is a need for you to be seen outside of your primary care provider, they will provide that direction. If you do not have a primary care provider, you don't have a physician who sees you on a regular basis, we do have 5 urgent cares presently that are open and operational. You can call any of those Caldwell urgent cares and they can provide you guidance. The urgent care are on a website called caldwellwaittimes.com. You can look that up and look at where the locations are of each of the urgent cares and their contact information. Basically, today I want you to know that we did open up a testing center. It's a respiratory diagnostic testing center. We opened that up. We're seeking to have people come to that diagnostic center through their primary care physician or through the urgent cares. We want to prioritize the people most in need and make sure that that center is able to address the needs of folks who are most likely to benefit from its services. So that center is up and operational. If your employees are showing respiratory symptoms, fever, those kinds of things, they should call their primary care physician, call an urgent care, a Caldwell urgent care facility, and they will direct them appropriately to the respiratory diagnostic center at the right time. So that is up and operational today. You may see it as you're driving around the community. We will take care of anybody who shows up there. We would prefer to best use our resources by having them go through the providers. Additionally, you may see we're setting up over the course of the next 24 hours a screening tent outside the emergency room, and this is in the case of having a significant increase in volume in the emergency room. We want to make sure we're triaging patients to the right part of the emergency room, with respiratory patients going to the right location and non-respiratory patients being treated separately. So that triage tent will be going up in the next day. You'll possibly see that as you drive by the hospital. We have our emergency room and our inpatient units. We have expanded our capacity and capability of taking care of patients in negative airflow rooms, and those units and locations are all set up. We are testing people and have been testing people the last week, and we are getting results from those tests. We have patients who have been on isolation in our emergency room and in our hospital that we are ruling out or assessing to determine if they have the COVID virus. To date, as was reported, we have not had anybody with a positive test at our facility. So I really think that we are well prepared. We have good partnerships in UNC Health System, and UNC Health System is bringing the full force of their resources to our community, and I'm very grateful for that. Personal protective equipment for our employees is something we're paying very close attention to. If you have listened to the news or read anything on social media lately, which I'm sure you have, this is a significant issue across the nation. As a manufacturing community and a community with some wonderful supportive industries, we are interested in receiving from any industry who might have N95 respirators or face masks or eye shields. We would welcome those donations to the hospital, and the EDC has offered to help coordinate that if you happen to have extras that you would like to donate. At this time, we have the supply and inventory we need, but we're just anticipating if there is a surge, we want to make sure that we can take care of our employees and our doctors and our nurses so that they can take care of your employees and our community. So that would be greatly appreciated. I really am grateful for several things, and I just want to end with that, and then I can take questions. But I'm really grateful that we have had this time to prepare as a community. The health department and our emergency command and the hospital, we have a little more time than some of our colleagues in other parts of the state. So I'm very grateful, and I want to assure you we all have used this time very, very diligently to put plans and preparations into place. I'm also grateful for our doctors and nurses, and I can't not say that. They are amazing, and they are stepping forward. And I'm grateful for our faith community. As a hospital, we have engaged the faith community. We've set up a weekly call with the pastors and ministers and churches across the county, and we have asked them to call in once a week and talk with us so that we can ask them to help us. Our first ask of the faith community is probably the same ask we would have of you. If you have healthcare providers in your parish, or if your spouses have healthcare providers in their home, they may need help with childcare, they may need help with meals, they may need help with walking their dog, because we need our essential healthcare workers coming to work this month. It's very important, and they provide a very important role. So anything you can do to be aware of that and provide that support is greatly appreciated. I'm just thankful that in this community we have the ability to work well together. We have great lines of communication, and everyone has been tremendously responsive as we put together our plan and as we prepare for the potential surge of individuals who are affected by COVID-19.
Thank you. To those of you who are watching this webinar and maybe watching on the county TV station, there have been some internet issues in Lenore this morning, and we see that we have had some of those here, but we understand that our connection is back, and we will be sharing this. We've taped it, and we will be sharing this a little bit later today, so bear with us. I want to also echo what you have said, Laura. Our community has pulled together. We always do, but it's been amazing to watch everyone pull together to do something that we're not really used to doing, which is pulling apart, the social distancing. We're not holding meetings. This is our first virtual meeting. I think that this is going to be something that we learn to do better, obviously, and more frequently as this goes through our community. So we will be providing you with better ways to connect without having to do it face-to-face. I know that this has created some hardship and will continue to for our businesses. Later this afternoon, the EDC will have on its website information that comes from the North Carolina Business Relief Resources. If you want to get to it right now, you can go online with Business Link North Carolina, or you can call them at 800-228-8443. If you're looking for funding, or if you want to have some assistance with SBA, if you need any kind of services, there are a number of things. I won't go through the list, but it will be available on our website. Yesterday you saw some SBA information that went out. That will also be there. It's currently on the EDC website right now. The most important thing that we feel like we can do is provide you with resources. We're not going to be the ones that have all the answers, but we can be the ones to field the questions and see about getting the best answers that we can as this situation changes. And I'm certain that it will from day to day. To the employers and their employees, I don't know which of you want to answer this question, but what would be the number one thing that you would want employers to know, Laura, as we go into this? We've had so many people say they think they're sick or they're worried. How do employers deal with that at the HR level when they present sick or worried, or maybe even have a real reason? Maybe they've traveled someplace and they need to deal with that. Can you help us talk about that with these folks on the front lines?
Yeah, I'm sure Ann and I would both be happy to talk about that. It is allergy season. It's the peak of allergy season, so I think most of Caldwell County is probably waking up this morning with a scratch in their throat, cough, and maybe a little sinus pressure, and that's very scary. I totally appreciate that. I think the main differentiator is having a fever. So that's something that should elevate your level of concern. And simply, we just encourage you to have your employees who may have symptoms and a fever to call their physician and provider, and we can best kind of allay their fears by helping them understand maybe their unique circumstance. So call your physician, call your urgent care. We should be able to help you walk through that maze. And I understand it's a very scary time. And we want to support you and help you get through that by providing the best answers that we can.
Anna?
Sure. Always, if someone's feeling sick, they need to stay home. If someone is sick, they need to stay home. I know that's very hard for a lot of people that they need to go to work, but in this sort of situation, like all situations, just like the flu, if someone is sick, they need to be at home. Just like Laura said, if someone is feeling sick, and we know it's that time of year, allergies, colds, things are going on, they do need to go to their primary care provider. They need to go to an urgent care. They need to go and see a doctor, but the biggest thing right now is if someone is not feeling well, they need to be at home, they need to be seen, and just answer those questions. Because what we're looking at with COVID is a fever and any kind of respiratory symptoms, whether it just be a cough, sneezing, just things like that with any kind of upper respiratory illness.
And one of the things that I think that most people are saying right now is the last place in the world that I would want to be is in a doctor's office, because there's so much, people are sneezing and coughing, and how do we know what that is? So especially for our older people, can you address that? What should they really do? How serious is this for them?
So I think that's a really good question, and that's why we're asking folks who might have a fever and respiratory symptoms to call ahead to the office practice. We have had several people do that already. Obviously, many people calling in yesterday, today, in the past week. If we are concerned, we will have the patient stay in the car, and we will come out to the patient, and we will not be bringing them into the facility. So the best method for us is if you call ahead, then we can assure that we meet you and keep the other clinical setting free from any kind of exposure. And we've done very well with that so far. Our clinics have really quieted down. We've canceled all routine, non-essential office visits, so the people coming in are people who have chronic illness, people who need to be seen in our clinics, and we are creating an environment where that is safe to do. And so if you do have employees or people with chronic conditions or symptoms outside of respiratory that need to be seen, they should feel safe. We're being very, very cautious and very, very careful. Our nomenclature in the practice is identify, isolate, and inform. So what we're doing is very quickly, everyone who comes in, we're asking questions, and we are isolating them immediately and then doing proper cleaning techniques if they have symptoms that we were unaware of. So we're quickly, I say isolate, but putting them into a room where they will not be able to cross-contaminate our environment. And then we're evaluating them very carefully and directing them to the best location for their care and treatment. I will say this is also flu season. We're seeing a lot of positive flu testing, and if you look at our process when people come in, we are first testing for flu with the rapid flu test, and then if it's negative, we're doing a follow-up flu test to make sure it wasn't a false negative. And that is our criteria for moving on to the COVID virus. And what we're finding is that many people have the flu right now. So of course it's best practice for people to stay at home with the flu also. But that's our protocol in our urgent cares and our practices. We're quickly asking questions of anybody who walks in. We're isolating individuals who have symptoms that would be of any concern, and we're cleaning the environment to assure that no one else is affected by that. To date, we haven't had any significant problems, and so I think everyone should feel very safe going to their physician today.
And Anna, would you talk to what should industry do to clean their environment? Talk to them a little bit about, what the responsibilities are, information that we ought to share with them for employers, what social distancing in the workplace might mean.
Sure. So on the cleaning side, EPA has a whole list of disinfectants, and we can share that list with you, making sure you're using the right cleaning materials, making sure you're cleaning every so often. I know in our area, it seems like they're cleaning every hour, just making sure things are clean, that you're having hand soap at the sinks, making sure that's there, but then also if you do not have sinks around or they're not able to get there, that your sanitizer has at least 60% alcohol based. With the social distancing, they're saying at least 6 feet apart, and there's been some confusion with the mass gathering. I know you may have heard about mass gathering, so The governor's still on, if he's not changed that, still on 100 people or less. However, we're following CDC and NCDHHS for all of our guidance, and those are two websites for all accurate information is CDC and NCDHHS. And their guidance is 50 people or less. However, the president did say 10 people or less. So between that 10 and 50, that's what we're going with. Basically, that is 6 feet away for more, and then what we're saying as well is less than 10 minutes. So that counts as a close contact. So that's really what it means by social distancing, just keeping less people in a room, confined area, 6 feet away. So if you can figure out a way to do that in your businesses, that would be very helpful to decrease the spread, and then also the disinfectants that we can send you that's approved for this different type of virus.
Well, I never thought that I would say at my age that I was so grateful for social media. But I am, because that allows us all to be connected and to share things when we do have to distance ourselves from one from another. As you know, the schools were closed, and that's caused a great hardship. And I was texting with Dr. Phipps a little bit earlier, and we were talking about our community partners. Our educational partners have done a fantastic job. Yesterday, they delivered 30,000 meals from out of the backs of trucks and cars and buses, providing those. They were for breakfast and lunch for 5 days, looking after our children, because this is a hardship for them and their families. We have a lot of folks who rely on our county services for their meals that way. They are also providing frozen items that can be prepared at home. They don't have the ability to do carryout just yet, but I think that they're working on that. And so hats off to that group of folks for meeting a very, very, very serious need within our community. I think we'll probably end up doing this again. We wanted to make sure we got out with you folks. If you have questions that you'd like to have answered and we haven't addressed them today, email me, dmurray@caldwelledc.org, and we will try to get you those answers and provide as many resources as we can. This is a very fluid situation. I'm sure that things will change by the time this afternoon and evening roll around. I think it's a very safe thing to say that it's not a matter of if we have a case, would you say? It's a matter of when. What you're doing to distance yourselves and take precautions is what is going to help us flatten the curve. I'm going to ask you, Laura, to come and address that, and then I think we'll be finished for today. Aside from wrap-up comments, if you folks would like to make them and give us that information.
Sure. Flatten the curve. That's something you may have heard, and it totally correlates with the social distancing. And my best recommendation to you would be for you to Google Flatten the Curve, and there's some good articles that show the benefit of social distancing. And probably the way I would say it is the best way to allow the healthcare system to take care of individuals who need our help is to make sure that we don't get overwhelmed quickly. So social distancing slows down the spread, slows down the pace of infection, and then those who are ill, we have the opportunity to get to them and provide the best care to them. If we as a healthcare system have too many people at one time who are infected with this virus, we will have a very hard time keeping up with their needs. So you all in your social distancing policy, the community college, the school system, you have all helped us be able to better help our community in the care of individuals affected with this virus. So that's flattening the curve. I will tell you that it looks like flattening the curve, it takes 2 to 3 weeks to determine the benefit of that. So we really are fortunate in this community that we've had time to social distance. before we have our first case, because that will help us significantly in flattening that curve. So thank you. I know it's very difficult for everyone, and I just thank you for helping us as healthcare providers be in a position where we can best help take care of this community. So thank you.
And just to tag on to what Laura just spoke on, the key takeaway here is to understand that, this is not something unique to this area. It's not something unique to this state or even the country. The flattening the curve, really to her point, is key here. Public health and emergency medical care are two very separate but equal things. So our key takeaway for all employers, employees, and honestly the healthcare community as a whole is to prevent the mass spread of this. We understand that the spread is there. It's already here. It more than likely is in our community. It's definitely in our state, as has already been talked about. But we have to eliminate the med surge. We have to eliminate that strain on the medical community, the healthcare community that overwhelms us. And the way that we do that is through you and our partners, with the social distancing, with disinfecting, using common sense in many terms, but for us, that needs to be the key takeaway. It's not that this can't be treated. It absolutely can be, and we get a lot of questions, and I know both of our partners here with the hospital as well as the health department are being asked consistently, why is this any different than the flu? Why is this any different than the response to heart disease or diabetes or anything else? Well, the key is the inundation of the healthcare system. The same thing happens every year with the flu. Hospitals get inundated. Hospitals and healthcare providers get inundated. The challenge here, though, is there's no fallback. So with it drastically involving every facet of healthcare and every community, every state, and the country, as well as the world, of course, we need to limit that. So anything that we can do to help you to push out, please let us know. We can absolutely add Deborah and all of your businesses on our situation reports. We get hourly and daily updates from not only the health department and the hospital with Caldwell UNC Healthcare, but also the state and federal government. So that information can very easily be pushed out to you. The last thing I'd like to finish on is social media is a fantastic thing, and I love that we're doing this digitally. But please relay to your employees and for yourselves, make sure it's verified sources. If you'll notice, sometimes on our updates, our numbers may differ slightly or greatly from news media and other outlets. However, ours are coming directly from the CDC and DHHS. Those are our verified accounts. So when we talk with our partners here, that's where you're getting those information. So please encourage them to use verified accounts, and obviously the EDC is going to be one of those through us. And anything that we can do to help you, please let us know.
And to tag on what Dino said, if a release comes out of it being a case, it will come from the health department. So just remember that instead of just hearing from other people. I also wanted to mention, I think we mentioned it earlier about the community pulling together. That is something that we have saw over the last few weeks of just everybody coming together. So I just want to thank you so much. I know there's been businesses and industries that reached out to me about helping provide for the community, because not only when someone goes into isolation and quarantine, they're there, but if they have no way of providing for food or any kind of necessities, that we have to help with that. So businesses have reached out to me to help provide. So I really want to thank everybody for that. And the community has really come together with this, and it's been really fantastic. So.
Well, and lastly, these are our frontline warriors. At this time, I don't think we really think about the risk to them and their families. We hope the very best and the safest to you, and we hope that this is going to go through our country as quickly as possible. Thank you all for doing your best on our behalf. And thank you for tuning in, and we hope to do this again.
Thank you, Deborah.